Hello, I am Dr. Rajeev Redkar. I am a consultant pediatric surgeon, which means I operate children under 18 years of age. So today we are going to talk on pediatric cancer. Now whenever a word cancer is uttered to any patient, there is a lot of scare involved with the family and the patient. And especially when it is with children, then it throws the entire family and the child out of gear. However, pediatric cancers are something that we have to deal with. The incidence of the problem is about 4 lakh children worldwide are as per date known to have cancers in a year. That's the incidence of the cancers. Now, which are the cancers that we see in children? The commonest solid tumor that we see is a cancer of the kidney, and that's called as a Wilms tumor. Besides this, there are also tumors of the liver, which are called hepatoblastomas. There are tumors of the nervous system in the abdomen, which are called neuroblastomas, and then there are intestinal tumors which are called lymphomas. And the commonest cancer that is found in a child is a blood cancer, which is called leukemia and lymphoma. So these are the variants of cancer that are seen in children. Now these, how do we pick up these children? See, a child who has fever of unexplained origin and not infective in origin for a very long period of time, then one should start thinking in terms, is there any other cause for this fever? These children who are known to have cancer have a failure to gain weight, which is very important in a child. A child should gain weight, but if they don't gain weight appropriately and they have other problems and their appetite drops, they become less active and they will sit in a corner and not be very interactive. In such cases, one has to think of any other diagnosis apart from the routine ones, and that's how it leads a pediatrician or a pediatric surgeon to suspect a problem. Then on examination of these children, if one can find a lump in the abdomen or lump in the chest or a swelling somewhere, or the child unable to pass stools or urine, then we suspect that there is something major going on and we investigate these children. And on investigations, it is possible to pick up almost 99% of the cancers in children. These may involve blood investigations, sonography, CT and MRI. Now a good thing about childhood cancer is that these are treatable in majority of the cases. Now 80% of the cancers are treatable in children, and these children live a normal life as adults. Now let's take an example of Wilms tumor, which is a cancer of the kidney. Now in about 20-30 years ago, there used to be a significant patients, children who would die due to this problem, but now the survivals are well beyond 95%. So in children's cancer, the outcome is very good and they lead a normal life after treatment. Now what could be the treatment for such patients? They may require surgery to remove the tumors, they may need chemotherapy, they may need radiotherapy, or they may need other advanced agents like immunotherapy. Now all these are available at the hospital that I work at, which is Lilavati Hospital. So we can undertake such cares in to a great extent and relieve the child and the family of the problem. Now the other thing that happens is the deliverance of these chemotherapies. Now whenever a chemotherapeutic agent like the anti-cancer drug is to be given intravenously, veins are very difficult to find in a child. So we have been putting ports for now more than 15 years. Now these ports are implantable devices that can facilitate the introduction of anti-cancer drugs, which are almost given in a painless fashion to the central veins. So therefore the elimination of pain because of intravenous access, and you can give very strong medicines without much local side effect where the injection is given. So these ports are a new facet to the management of cancers, which is available at Lilavati Hospital. So in general, cancers are identified in children. They can be solid tumors, they can be blood cancers, and they are treatable and the outcomes are very good in children. Thank you.